My name is Anil Kapur. I'm a medical doctor and I'm currently the chair of the World Diabetes Foundation. Why pregnancy is such an important aspect of looking at health from a future perspective is because of the fact that that's where life begins. And we are starting to understand the concept of the developmental origins of health and disease. So we now understand that the fetus in the womb actually predicts based on the maternal health and the uterine environment, it predicts in what kind of a world it will be born into, and therefore adjusts its development to suit that environment. Now what happens is that if that environment, when the child becomes an adult, is very different from the environment in which it predicted it would be born into, then the health of the child is affected, because the body systems are not geared to be able to face those kind of things. And this becomes very important from a perspective of countries that have had many years of undernutrition in the low and middle income countries, where children have been born to mothers who have been undernourished during pregnancy. And then this child predicts that it will be born in an environment that will not have enough. And therefore, the child is born small, the organs are small. But 30 years down the line, when you see an economic development happening, then the environment that it is now living in is very different from the environment that it predicted it would be in. And this is exactly why you're seeing a massive rise in diabetes globally. For example, China, India, these are countries that in the past 30, 40 years were had low socioeconomic development, and now they are developing in a different way. So we are seeing a great rise in diabetes. And it's not just diabetes, this will start impacting other non-communicable diseases. The other aspect is that what's happening is that if it is a girl child that was born to this mother, then this girl child will suffer from hyperglycemia in pregnancy. She is at a much greater risk of developing hyperglycemia in pregnancy, and then she would get gestational diabetes, and because she has gestational diabetes, the offspring that would be born to this young lady will likely to would be born big, will become obese, and if it happens to be a girl child again, then she would be at an increasing risk of developing future gestational hyperglycemia, gestational diabetes, and therefore this risk is getting accumulated for each passing generation. And therefore, if we have to look at addressing the prevention of diabetes, prevention of obesity, prevention of cardiovascular, cardiometabolic diseases, then we need to focus on the health of young reproductive age women. So I would say that the best thing to do is to have pregnancy when you are in the prime of your health. So there's a concept around fit to deliver, and that ensures that men and women, reproductive age, when they are in the prime of their health fitness, and when then they conceive and the children that are born to them actually get a health advantage. So I call it, what is the best gift that you can give to your child is to being born to parents who are in the prime of health. And this child is born with a health advantage, because if the mother has been overweight, obese, has hypertension or has diabetes, then this child is programmed in an environment where he or she will not be born in the most optimal health. I'll give you an example. There are, say, 130 million live births that happen around the world every year. Of these 130 million births, about 56 million births happen to women who are anemic. about 46 million births happen to women who are overweight or obese. About 26 million happen to women who are undernourished. About 22 million of these women have hyperglycemia in pregnancy, and about 10 million odd women have hypertension during pregnancy. Now you look at the conundrum of this, that these children are being born to mothers who have all these conditions, which actually predispose them to starting life with a health handicap. So the best gift that we can give to our children is to be born when the parents are in prime of their health. The other thing and why is this rising trend happening is because of the fact that increasingly women are getting married late, they are conceiving late. There is a rising trend in obesity, overweight, and the past undernutrition that I talked about earlier is now creating an environment of overnutrition in young women. And that's why you're seeing in countries like India, China, Mexico, Brazil, everywhere, you see a lot of young women are overweight or obese. They have a condition called as polycystic ovarian disease, which all creates a metabolic environment where they develop hyperglycemia during pregnancy, and this cycle is getting repeated again and again. You said it in the most appropriate way, that what's happened is, if we look at the Millennium Development Goals, everybody on the maternal and child health aspect, everybody was concerned about saving mothers and saving these newborns. We did a great job in that, and it's not to run that down. But what we did is we saved mothers and we saved children who are at the greatest risk of future NCD complications. Why it is so important to address pregnancy as an important aspect is because when we diagnose or when we test women during pregnancy for conditions such as hyperglycemia, what we are doing is we are addressing three things. Number one, we are identifying a woman who's at the highest risk of pregnancy complications. So women who have hyperglycemia in pregnancy have obstructed labor, they have postpartum hemorrhage, they are more likely to get infections, they are more likely to get preeclampsia and hypertension. And the child that's born to them is also at great risk because of obstructed labor, because of being born large in size, having neonatal hypoglycemia or jaundice, and these newborns have to be admitted in intensive care units. So there's a whole range of issues around delivery and pregnancy. Then if you've identified these women, then you have the opportunity of doing something postpartum and following them up to address that their mother and child pair can be given preventive care. So for example, I say that, and this is a tragedy of the health systems, that even when we diagnose women with hyperglycemia in pregnancy or gestational diabetes, nature has put a spotlight on these women, that they are women who are at the highest risk of future diabetes, they are at the highest risk of future cardiovascular diseases, and yet we let them walk away from the spotlight, because then we say they are no longer pregnant, they are no longer diabetic. So what do? They don't come to the health system. I say no, they do come to the health system. They come to the health system with a baby. And this baby itself is at much higher risk of all these complications. So why can't the health system work together to ensure that we can identify the child's wellness card by saying that this child was born to a mother who had a pregnancy complication, and therefore ensure that the nurse or whoever is providing vaccination or in the well baby clinic, that the mother is talked to for extra 15 minutes to ask her that she must lose the weight that she gained during pregnancy, that she should take care of her health, that why it is important for her to breastfeed. Because interestingly, breastfeeding, longer you breastfeed a child, if you have had gestational diabetes, the greater protection it offers you from getting into type 2 diabetes. So there are these very simple things that can be done. Unfortunately, we don't do that. The other angle that's very important to look at is ensuring how do we make young women of reproductive age aware of the importance of their health and ensuring that they are checked before they become pregnant. Unfortunately, 40% all pregnancies that happen are unplanned. But we need to create greater awareness amongst young women to ensure that when they get married, when they think about having children, that they are focusing on their health. Of course, nutrition and being in a normal body weight, eating healthy, that's very important. There's another aspect that I did not talk about, and that is the issue around environmental pollution. We are being exposed to a lot of so-called endocrine disruptive chemicals. These are part of cosmetics, part of shampoos, part of lipsticks, part of the plastics that are around everywhere. And it's important to understand that all this in some way or the other has an impact, because these enter the mother's circulation, and through the mother's circulation they enter the fetal circulation, and the concentration of these chemicals in the baby in the womb is often 2 to 3 times higher than even in the mother's blood. And these are important things that we should understand. So when women are pregnant or planning pregnancy, I think they should start and seek advice about what kind of things that they need to avoid. We are aware of not smoking, we are aware of not drinking, but sometimes we are not aware of some of these issues that are there in our houses. Paints, different kind of plastics. We use a lot of micro cooking, and sometimes those materials are also harmful, and they go into our food and go into our body, and they would transmit to the baby, and that also has a very big impact. So those are some of the issues that are very relevant that people should know about. I think that's a very important question, and sorry I didn't talk about it earlier. But pregnancy is not only a very big stress for the body in terms of the endocrine system, the cardiovascular system, but also to the mental health. Because if women are stressed about their work, they're stressed about other issues, this stress does get transferred to the baby. And well, there's not enough evidence to show, but things like ADHD and some of the other things that we are starting to see in a much bigger scope nowadays perhaps has some link to the mental state of women when they were pregnant. The fact that women who are under stress have pregnancy complications, they are more liable to get preterm deliveries, they are more liable to get other complications of pregnancy. And so ensuring that, and well, I come with a background from India, so I would recommend doing yoga and meditation, and I think that's a very important aspect of a healthy pregnancy. Well, it's a little tricky because we're talking about from a global perspective, and different countries have different systems of how the health systems operate, and there are lots of information available on the internet. Not all of it may be the right thing. There are lots of apps that are available, and I can't recommend one single one. But I think the best is to be able to find local resources, talking with your obstetricians or your nurse midwife. But sometimes talking to women who might have had these complications themselves is a very good source, because they might be able to guide you better. Yes, so when we start looking at who is at risk, so when we start assessing the risk, one of the most important elements is the family history. So if you have a history of a mother or a father or a sister or an aunt that has had diabetes or has had gestational diabetes, then that becomes a very important part to remember. And also to remember that if how long has that existed, and so that's a very important aspect. So thank you very much, Elsa, and I hope that I have been able to provide some useful tips.
Definitely. Thank you.